I have been saying this for about 5 years, over and over and over again. And so I've decided to make a video about it. My name is Dr. Rodriguez Stephen. I'm a family practice doctor, and I started using acupuncture about 18 years ago, and this is an acupuncture needle. What I discovered about acupuncture is that it wasn't what I had been reading in the instruction book of traditional Chinese medicine. It is a tool with an instruction book. And a tool with an instruction book can be very limiting because a tool can be used for many other things besides what it was designed for. Okay, so, and I've been telling this story for a long time, and I just wanted to put it on video so that you can kind of see what is missing, what I do, what is missing, and what doctors in the past have discovered about healing pain, and why this is a key to unlock the healing forces within, the natural healing forces within. Okay, so if you have pain in your lower back, it's caused by muscles. Muscles is the only organ system that causes everyday aches, pain, stiffness. If you get injury, most of the injury go into the muscles, and it's rebounded back out into space because muscles are shock absorbers. The treatment for muscles is massage, stretching. Stretching and range of motion exercises. That's it. Muscles cause pain. The treatment for pain is massage, stretching, and range of motion exercises. It was like that in primitive times. It'll be like that forever. Now, so how do you massage? You massage with your fingers and hands and doohickeys. But sometimes you can't reach in far enough into the muscle. See, that's bone, that's muscle, that's skin, that's a poor finger. So if you massage this part of the muscle down at the bone, you can't reach it. So you do ischemic acupressure. You push on the muscle, you starve it, and then you release it, and then that sets up internal natural healing. Natural healing. The forces within. Okay, so now let's say you massage the muscle on top, but it's still there. You can't quite reach it. Then what you use is a needle and reach right in. And then the needle can massage what your fingers can't reach. They discovered this, about 7,000 years ago. And it'll work in another 7,000 years. So muscles cause pain. You treat the muscles and the pain goes away. The muscles are the source of pain. And if you don't apply remedy to the source of pain with touch, then the pain will not go away. It'll just sit there. Muscles have the ability to store this stress in little teeny weeny errors of repair. And if your fingers can't activate a little error of repair or a little scar, then it'll just sit there waiting on a force to unlock it so that Mother Nature can go in to heal it. Okay, so massage, needle, poke, 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 and Mother Nature goes in. You open up the scar, let nature in, and it heals from within. It works beautifully, perfectly. Just like water quenches a thirst, this quenches what is in the muscle system. Muscles are the primary location of everyday aches, pain, stiffness, injury. Always, and it will always be. It's the primary. You apply the remedy to the primary, and the pain goes away. Now, the forces within muscles can sort of, let me try to get this right. That's a bone. Ooh, 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 ooh. And those are muscles around the bone. If the more muscles, the more tatters the muscles get, the tighter the muscle becomes. So what ends up happening is that the muscles force the bone tighter on itself, which causes some scarring and some stress. And it looks like that. That's normal. That's stressed. When you get an x-ray, that's what you see. But that is the secondary of the primary. The primary are the muscles around the joint. So you treat the primary, and then this can potentially go back to a healthier state. Now, this is huge. So throughout the past 30, 40 years, you take away massage, you take away physical therapy, you take away stretching, heat, range of motion exercises, and then you only give the patients one of two choices: pills or the knife. This is the knife. You can treat the muscle with a knife, and it works, just like a needle works. They both work similar, except this does a lot more damage than this. Why use this when all you need is this? Now, sometimes this doesn't work because the scars are too dense. Then you take the other tool out and you use this one. This has a cutting tip on the end, and it slices into the scar a lot better. And you can feel it as you go in. You can, and the patient feels it too. So these are the most important tools in medicine: fingers, little probe, and different probe, cutting tip probe. This is reserved for appendicitis, gallstones, removal of tumors, cancer, those type things. This should not be used for the treatment of muscle pain. But because of how society has been, it's a fallacy that was started in the 50s and 60s, that you can see pain on an x-ray. You see it? That's the pain on the x-ray, and we can fix that. How do we fix that? Oh, easily. All we have to do is cut it out, and then we put in steel. you can see how that doesn't make sense. That's natural. That's alive. That can automatically heal itself by natural forces. No matter what it looks like, it can heal. The human body heals no matter what. The human body heals, is in a constant state of healing. It will heal a wound 100% of the time. Every wound 100% of the time. If it cannot heal a wound 100% of the time, that means something is in the way. If something is in the way, you remove it, and then nature can go in and repair all of that. So what's in the way? Muscles. You remove the muscles, and then Mother Nature can restore you back to normal, a more normal state of well-being. So what's in the way of massage? What's in the way of this or this? The fallacy. The fallacy and this aspect of allopathic medicine, which is either a pill or the knife. And they don't give you any options. Now, let me show you all the options that are a derivation of this. So, back in the 50s, 60s, 70s, 30s, 40s, 50s, 60s, and 70s, there's these doctors who came up with the idea of using a syringe with a substance and a needle. Now, a reasonable mind would say, hey, that's the same thing as this. That's the same thing as this. Very similar. Matter of fact, it's exactly the same. It just looks differently. You can put something in here to trick yourself, basically. So, saline and lidocaine and saline, this is what Travell and a lot of other, Travell Simmons, Racklin, Baldry used. It's just called wet needling. You put lidocaine and salt water in there, and then you inject as you go in. You inject as you go in so that you can stimulate painlessly. Because sometimes those little errors are very painful. You touch them and the patient will scream. So you put in a little lidocaine and you numb it so that you can work in all the way down to the bone, and it'll go through a healing cycle. And on the other end of the healing cycle, the patient will say, Doc, I feel better. I have less pain, better range of motion. So the next step is just to apply the remedy as needed on a regular basis until the patient is restored. The patient has to be restored, because if you leave any of those little errors, sometimes they'll regrow just like weeds in your yard, like dandelions, and they can just reestablish themselves. Okay, so no, that's not the whole story. So you do this, and then you apply this massage, stretching, range of motion exercises, and then wellness in the form of a well-balanced life, diet, minerals, sleep, hygiene, and yoga, or any type of stretching exercises. Then you need aerobics to heat up your muscles inside. And that is the full benefit of Mother Nature. Okay, so let's go back to this. So all these doctors tried to figure out this. But in trying to figure out this, I have a theory. Is back in the 40s, 50s, 60s, and 70s, when communism was big, saying anything related to Far East was a taboo. So if you said acupuncture, people would just put you in jail. I mean, anything related to China or Far East or even Middle East, on any account. So what they did was they just switched tools and modified acupuncture in all these varieties. So you have saline and lidocaine. I use 50-50. You have sugar water. You have stem cells. You have steroids. You have Serapin. You have biologics. Then you have platelet-rich plasma. All these do the same thing. All these use the same mechanism of action, which is triggered by this and this. And that is it in a nutshell. So if you go in for platelet-rich plasma for your knee, then it'll work. But not what the doctor thinks. It's not what he thinks. It's not his theory. His theory is built on the action of this needle. Oh my goodness, I forgot gun. C-Chan gun. Oops, that's just one N. MD. Basically, he took acupuncture, which is an art and a tool, and took the tool away to come up with his mechanism of action, which is called intramuscular stimulation, which is you stimulate in the muscle with a tool. And it can be any tool. This tool you don't want to use. It'll work, but you will overkill, traumatize, betray, confuse, distort the true science. So again, C-Chan Gunn is the person who linked hands-on therapy with the benefits of hands-on therapy outside to the inside. So you extramuscular stimulate, you intramuscular stimulate, and then you nourish, and then the pain goes away. It works 100% of the time. 100% of the time. Fascinating. And that is it. Let me go backwards. It's not it. This fallacy was perpetrated in the 40s and 50s because a group of doctors figured out that chiropractors were getting patients better, and they needed a ploy to pad their bottom line. So they just basically made a true into a false, and a false into a true. And in doing that, they basically destroyed the future of medicine. Because pain, true, most common cause of pain is in the muscles. It never leaves the muscles. The primary location of everyday aches, pains, and stiffness is in the muscles. It never leaves the muscles. So what they did, they made that a false. They said pain is in an x-ray. And it's not in the muscles. Then they says the false to a true is we can fix your pain. We can fix your pain by fixing the x-ray. So they took the false into a true. And this false to the true is very, very persuasive. There are so many invisibles that you just believe it. They show you the x-ray. You say, oh my goodness, look at that. That's bad. I need that fixed. They says, well, This is your option. Or this is your option. So you only give the patient two options when the patient has all of these options. All of these options are not covered by Medicare. None of them. To the level that I would want. So Medicare has been corrupted. The policies and procedures in Medicare have been corrupted to offer you only this and this. Matter of fact, if you even attempt to use these, they will persuade you by not paying you or making you charge more, which funnels you back into this chaos. So, and also what they did was they also made false legal. In the rules and regulations, it's absolutely legal to only offer you two choices. It's absolutely legal that if this choice fails, to deny it. And how they deny it is by blaming you or some procedural glitch, or they blame everything except the lie or the fallacy. They don't tell you the truth. This is all the truth. And if you have any questions, thanks for listening. If you have any questions, just let me know. I'll do this later when I get a chance. I've been a bit busy lately, so you can look at my Facebook page, my website, and most of the information is there. Have a good day.